Okay, now let's debate. Orthopedic surgeon Lee Heeb agrees with us that what American healthcare needs is less government and more free market. Pediatrician Steve Auerbach says that's wrong, that the free market doesn't really work for medicine, so we need more government control. Steve, you say Obamacare even doesn't go far enough to protect people.
Sure. What we need is health care for all Americans, health care access for all Americans. And the way to achieve that, step number one, would be true universal health insurance through a single-payer healthcare system.
Like Canada, Britain has.
All the Western industrialized countries, all the Western industrialized capitalist democratic countries, not just all of Western Europe, Japan, Taiwan, Germany, folks have access to go choose the doctors they want to go to, choose the hospitals and the clinics they want to go to. Under our system, what we've proposed is single-payer universal health care, H.R. 676.
You say we, you have a group pushing for a national health
program.
You say it's a moral duty.
Yeah, we believe, and I think many Americans believe, maybe even most Americans believe, that health care is a human right, that it's one of those things that you live in America, you're an American, we should have an all-American health care system, an all-American health care insurance. Everybody would have insurance automatically, no more churning on and off insurance.
Dr. Heeb, this sounds awfully good to people.
It sounds good. Canada has a universal health care system. They have people waiting 2 to 3 years for a primary care doctor. Now, you know, the problem is, in Canada, for example, you have to wait 6 to 9 months for a CAT scan. There's no place I can't get you a CAT scan in an hour in America. In fact, we just caught Mary Leahy, or however you pronounce her last name, one of the former medical executives from Canada, sneaking across the border on taxpayer dollars to come to the Mayo Clinic, which is for cash. And why is it? Because it sounds good that they have access to all this care and everything, but socialized systems do not produce the goods and services that you need to actually have quality medical care. You know,
let me ask you, you've heard of the Soviet Union. It didn't work out
Well, we're not
really
talking the Soviet Union. We're talking Germany. We're talking Taiwan. And, yes, we're talking Canada. And, you know, these anecdotes that are put out by some organizations simply don't hold up when you actually look at the statistics. In fact, there is not a net flow of folks crossing the border to the United States.
I've seen the advertisements.
And, in fact, Americans had wanted to get their drugs from the Canada side because they're so much less expensive.
But that's because they freeload off of our relatively free market system.
Well, you are correct in one thing. The drug companies, for example, the same multinational drug companies, the same drug products from the same factories that are sold all over the world, are less expensive in every other of the developed capitalist democracies in the world. Half the price in Canada, a quarter of the price in New Zealand. And this whole business, you know, if you actually go to Canada, Canadians support their system. They don't want the American system. If you look at their own polling.
Dr. Heeb, they support socialized medicine.
Well, I can't really speak to the polls, but I can tell you that it's not just anecdotes. When you have, you know, people that are in charge of the CAT scans, people that are physicians in Canada saying, look, we cannot get our patients these studies.
What would you do about the poor and the uninsured?
I'm old enough to remember when we didn't have government health care and people weren't dying in the streets. The problem with the poor is that everything is priced out of everybody's range. It's not just about the poor. I have trouble affording health insurance. And it's because government regulations are killing us. They're making everything more expensive. They're putting hospitals out of business. You know, hospitals are closing right now because they cannot afford the cost of the regulation and they cannot afford the penalties of not being in compliance with the regulation. So the answer for the poor is we need to get the cost down. You know, I was a doctor on the Mexican border for 20 years. I took care of everybody. People coming across the border that were legal and illegal. And let me tell you, before government got involved in health care, the fruit pickers, the vegetable pickers that came across the border, they paid cash for their health care and they could afford it. Their wages were enough to afford everyday health care. Now it is not. The first answer is to get the cost down by deregulating things, because it's the regulations that are killing us.
You say people were dying.
Well, and in fact, we agree on part of the diagnosis here. We agree that the cost, the unit cost per visit, per CAT scan, per test, per operation are too high. If you, everybody's familiar now with Steve Brill.
I'm too old.
Well, no, but the costs are much higher in the United States than they are in these other countries. In fact,
because they freeload off us.
No, all these other countries that have the universal health insurance, the system has lower costs, lower overhead. Free market works for many things. Supply and demand works for many things.
Yeah.
It doesn't work for healthcare. Healthcare economics actually is different.
Why not?
You know, we always talk about patient-centered health care. Patients can control costs. Free markets control costs when patients choose cost and value. The only way
that means the
government
patient
cuts
spends
costs,
her own
But
money.
when you get sick, you're
Right.
not going around checking the prices of
Well,
Dr.
no,
A
wait
or
a minute.
Dr. B.
You don't need to.
Well,
That's
actually,
the way
you're not
free
able
market.
to.
Hang on a sec. The way free markets work is you don't have to make the decision when you get sick. When your car breaks
That's
down,
right.
you know which is the good mechanic. Word gets out about which are the good doctors or hospitals. Everybody says,
And
healthcare is special, but every field is special and different, and the market works.
It sounds nice,
And
but in
you
fact,
buy
it's a
real
fantasy, and it's not
insurance.
how healthcare works. And in fact, what's funny here is, you know, folks think I'm the pie in the sky dreamer, thinking that we should have universal health care for all, and that's the moral right thing to do, and it can be done. It turns out that's also how the healthcare economics works and how the healthcare systems work. And you know where we know this from, among other places recently, is Taiwan. Taiwan, a capitalist country,
It doesn't work.
went from private insurance. They realized it was hurting their people and it was bad for their business, and they went to universal single payer a few years ago.
Well, it took the Soviet Union 70 years to break down.
We're
takes
not talking
these socialist systems.
We're not talking communist or
time to
dictatorship.
collapse.
You may want to
Calling
talk about
central
Talk about-
planning.
Nope.
It's the same thing.
No, it
I'm sorry.
isn't.
Dr. Heeb, you get the last word.
Well, I mean, look at the cancer death rate in Europe versus America. We do much better. Our outcomes are much better.
Much worse.
And why is that? No, actually, that's not true.
Systematic comparisons by the OECD, by
If you're a
WHO.
man-
Outcomes
no,
are
this is no,
They're
this
not.
is Lancet.
Thank you,
This is-
Doctors Auerbach and Heeb. We're out of time. Coming up, big government now.